Hey anatomy students, I'm back with another video. This one's going to be on the histology for compact bone. So as you can see, compact bone is going to be different from connective tissue and epithelial as it does not dye as pink or purple. We have a lot of gray, white, black, and there's a lot of patterns that are different too. We have a lot of circles within circles and within circles. And now, although different from the other connective tissues we've reviewed, this connective tissue, bone, is going to be mineralized. And so what does that mean? A lot of this gray is actually not alive. It's calcified. The other tissue that we saw, those had living components to it and weren't mineralized like these tissues, which are harder and the other ones are softer. Given that information, there are no fibers present in this picture, and what we have are patterns of calcified rings, and these rings make up larger units that are called osteons. And we can see that there's a unit right here, right over there, and like 3 to 4 more just around on this slide. In this picture, I've indicated where these isolated units are so that we could go in deeper as to who do we need to identify and what will you need to know for your next practicum. As I've mentioned already, we have the osteon, and that is the functional unit of all compact bone. In each osteon, there's going to be what we have is concentric lamellae. As I wrote here, concentric means around a central point, and lamellae means layer. So per each osteon, you're going to find multiple layers of circles within circles that are made up of bone matrix, okay? And so we've heard that word matrix before, and that is just indicating the substances outside of the cell. And I'll give you a hint real quick. The black dots that you see on this slide are locations where we will find the cells, also known as osteocytes. Now, continuing on with that central point, we call this the Haversian Canal, named after some guy with the last name Haversian, or also the central canal. And that central canal is what houses the nerves and the blood vessels that will supply nutrients to these surrounding rings of neighboring cells. And now I'm going to point out here in that purple, we have what's called this circumferential lamellae. And this is merely the linear layers of bone matrix that are going to surround the greater community of osteons, as you can see in this slide. I'd like to also mention that that portion that is mineralized is made up of calcium salts and is considered inorganic material, which is best for maintaining a very hard structure, as I said earlier, as opposed to what we see in connective tissue. We see organic material, which is comprised mostly of collagen, and so that's what makes it softer and has more tensile strength and flexibility, unlike solid calcium. Now in this picture, I've zoomed in so we can isolate for one osteon, and so as you can see, this is sort of like one great community here. You have a central canal, which is a nutrient source that is going to feed the surrounding neighborhoods, if you will, in this picture. And in the next slide, I'll show you an example of how you can visualize that. So this is a very oversimplified image, but I think it takes that message home as to having a central place where there's nutrients that which the neighboring individual people, or in the case of bone, the cells, can receive nutrients from that central canal. So let's introduce this osteon once more. In purple, I've outlined the osteon. In blue, I have indicated examples of where the osteocytes will be. And in green, we're introducing a new term, which is called the lacuna. This is the space at which the osteocyte will reside. I like to think of it as its personal bubble or its house. And then we have in the yellow lines what we call canaliculi, and these are essentially baby canals that feed from that original central canal for delivering nutrients to those surrounding cells. And as far as how to pronounce it, I like to put "can I lick your eye?" just so you can get a rhythm of how to kind of say it. Obviously, that's not how you say it, but it just makes it more fun. And so likewise, you could see this is kind of that analogy that I brought up earlier. You have your central canal, you have that first ring of neighbors who receive that initial nutrients to and from the water ring hole in front, and then we have the other surrounding cells or inhabitants in those lacuna that I indicated in the little houses. So you could see it's very consistent as to how the cells might receive nutrients as well as deliver waste to that blood vessel so that it can send it out through the rest of the circulatory system. In some ways, you can think of it as an irrigation system that the Haversian canal provides, and each osteon has their own system, and collectively, this is how the bone overall is able to maintain the nutrients and delivery of waste to keep it alive and functioning. Now, you might be wondering what I'm doing with this slide here. What I have here is a representation of two different cells under different stages of bone development, and this is very much relevant to the histology slides because you as a student might have heard of an osteoblast and an osteocyte, and you might wonder, when is it appropriate to use the terms in identifying something on a slide? Well, like I mentioned earlier, the osteocyte is going to be what resides within the lacuna. I have that indicated here on the right side. But when does an osteoblast become the relevant answer? I have indicated on the left that the osteoblast is the cell when it's actively laying down an osteoid matrix, versus the osteocyte is when that same actual cell, the osteoblast, formerly known as osteoblast, actually gets trapped within the osteoid that it laid down for itself. So just so you're clear, the osteoid is that bone matrix. I like to think of it as someone who's like laying down cement, essentially, and then that person who laid down the cement trapped themselves in it and now became a different person. So if you can keep up with that analogy, that's essentially what's happening here. The lacuna is the house made up of the osteoid matrix that essentially trapped the original osteoblast into now an osteocyte sealed within that bone matrix. And so if I was your professor and I asked you what, I had a pointer on one of these black dots here within the concentric lamellae, and I asked you, name this cell, you should answer as osteocyte. So anyhow, I just wanted to make that clarification because I know you're going to be bombarded with so many different terms and you might not know the difference, but at least I can indicate some of that for you. So hopefully you do well in your next practicum, and hopefully I caught you before you actually took it. So good luck with your studies, and I'll see you in the next video.